Hi everybody, Jackie here with Dr. Bilski of Bilski Family Dentistry. How are you doing today?
I'm good. How are you?
Wonderful, doing good. So today we're asking the question, what is cracked tooth syndrome?
Cracked tooth syndrome is not very scientific, but it explains a lot of problems patients come in. Somebody may come in and say, every time I chew on a pretzel, this one tooth hurts. Take an x-ray, we can't see anything. Or I drink something cold, it's killing me, but then it goes away pretty quick. Hot, tapping, air coming across it when you breathe in. You're outside in the winter in Ohio. You go inside, so it's minus something, to drink a cup of coffee, and that gradation of temperature change is huge, and your tooth hurts.
And your tooth hurts, one tooth, but nothing, that you can't see anything.
And then you come back into my office and like, Doc, it's killing me. It doesn't look like anything, Jack. And so that's called cracked tooth syndrome. When you take an x-ray, because the way the x-ray goes in and the way the grain, if you will, of the tooth, they're called tubes and rods, you cannot see the fracture because it's vertical.
Oh, so you can't see it when you're examining the mouth, but in the x-ray.
That's why a lot of patients, my doctor doesn't know anything. She says, I need a crown or I need a root canal. There's nothing wrong with that tooth. He showed me. Yeah. So the way we do it is we check your bite.
Okay.
Maybe do a little adjustment. I think if you had fillings done before that black paper or red paper you bite on, we smooth that down.
Yep.
And if it goes away, then you're great. If it doesn't, then you come back and we put a temporary crown. Okay. Or we put a crown on that's glued in temporarily. Right. So if you think about it, if the tooth is split and then we close it and support it so that you can chew on it and there's no pain, then we've eradicated a fracture. It's all good.
You're good to go.
If it isn't feeling good, pop the crown off, do the root canal, put the post in, and then put the crown back on. Now we are completely surrounding it, and in most cases it takes care of the problem. Right. So it would look like this. You come in on Monday, my tooth hurts. You've been coming in a long time. I tell you need a temporary crown or a crown we make. We can do it in office with our CEREC machine. Yep. So 2 hours later, you got a crown on your tooth that's temporarily cemented. Beautiful. And then you're fine, and you come back 1 month later and say, I'm fine. We glue it. Yeah. See ya. Doc, it's 2 weeks. It is not getting better. Yeah. All right, Jackie, come on in. We'll see you for about an hour, hour and a half. We'll get the root canal done, put the post in, and glue the tooth on temporarily, and then that takes care of it. So the cracked tooth syndrome part is, by nature, we want to be more conservative. Right. So just put the crown on, minimize procedures, minimize costs, visits to the office, and then get to the point where, it feels pretty good and cap it. And most of the time, that's what happens. As a matter of fact, we had somebody in today. We actually did nothing because let's just wait and see what happens on that one. And he is instructed. Ron knows that if this is what he needs, he'll come back and he'll be there 2 hours to put the crown on, and he goes and.
Well, and it's great to know your option, know how it's going to work, and say, I'm going to get the temporary, let it sit, make sure it's good before we, glue that in place, or to make sure we don't need a root canal or something else.
So yeah, in our practice, we can go right from start, step 1 to step 4 in 2 hours. Right. And if you completely permanently cement the final crown, now you have to drill a hole in that crown you just paid for. Yeah. So that's why the cracked tooth syndrome protocol means, let's just see how it feels and then finish it up when it feels good.
And this is for the benefit of the patient. And, at the end of the day, you are the patient. It is your option. And Dr. Bilski and their office is here to provide you with the potential solutions for your needs. But you need to get in, have a consultation, have an assessment, see what's going on. If you have a cracked tooth, if you're feeling pain on one of those teeth, it could be cracked tooth syndrome. And there's a great protocol, that you just told us about. And this is like you said, it's a protocol. It's kind of a foolproof way to tackle that situation.
Nothing's perfect, but most of the time we nail it. It's like, no, my tooth feels great, Doc. All right, let's glue it.
Glue it.
Be done with it.
No, it doesn't feel great. All right, time to go in for that root canal and get you that long-term solution that we now know we need.
Absolutely.
Yeah. So if you are having a cracked tooth syndrome, if you are feeling pain when you get that temperature change or that kind of sensitivity when you're biting down on something, could be a cracked tooth. You want to go in, get that assessed as soon as possible. So give Dr. Bilski's office a call at 216-524-4410 or visit them online at bilskidds.com. You can also drop by their offices right off of Rockside Road in Independence to schedule your appointment with their office staff. Thank you so much, Dr. Bilski, for talking to us about this today.
Thanks for having me.